The menstrual cycle is a fundamental aspect of a woman's reproductive health. It is a natural process that plays a crucial role in the ability to conceive and bear children. It's a complex series of hormonal changes that prepare the body for pregnancy. These hormones, including estrogen and progesterone, work in harmony to regulate the cycle. This cycle typically lasts about 28 days, but it can vary from woman to woman. Some women may have shorter cycles, while others may experience longer ones. It's important to remember that every woman's body is unique. Factors such as stress, diet, and overall health can influence the length and regularity of the cycle. The menstrual cycle begins on the first day of your period. This marks the start of the follicular phase, where the body starts to prepare for the next potential pregnancy. This is when the lining of the uterus sheds, resulting in bleeding. The shedding of the uterine lining is a natural way for the body to reset and prepare for the next cycle. The bleeding usually lasts for 3 to 7 days. During this time, some women may experience cramps, fatigue, and other symptoms. After your period ends, your body starts preparing for ovulation. This phase is known as the follicular phase, where follicles in the ovaries mature. Ovulation is the release of an egg from the ovary. This typically happens around the middle of the cycle. It usually occurs around day 14 of a 28-day cycle. However, this can vary based on individual differences and external factors. However, the exact timing can vary. Some women may ovulate earlier or later, depending on their unique hormonal patterns. After ovulation, the egg travels down the fallopian tube towards the uterus. This journey is crucial for potential fertilization. If the egg is fertilized by sperm, it implants in the uterine lining and pregnancy occurs. This marks the beginning of a new life. If fertilization doesn't happen, the uterine lining sheds and the cycle begins again. This process is a natural way for the body to maintain reproductive health. This intricate dance of hormones and physiological changes is essential for a woman's reproductive health. Understanding this cycle can help women manage their health better and make informed decisions about their reproductive choices. Menstrual cycles can vary in length from woman to woman. A cycle is considered normal if it falls between 21 and 35 days. This means that some women may have shorter cycles while others may have longer cycles. Irregular periods are defined as cycles that are consistently shorter than 21 days or longer than 35 days. It's essential to understand that occasional variations in cycle length are common and usually not a cause for concern. However, persistent irregularities may indicate an underlying issue. Factors that can contribute to irregular periods include stress, weight changes, and medical conditions. Keeping track of your menstrual cycle can help you identify patterns and any potential irregularities. This information can be valuable when discussing your health with your doctor. Hormonal fluctuations throughout a woman's life can significantly impact menstrual regularity. During puberty, as the body undergoes significant hormonal changes, it can take several years for periods to settle into a regular pattern. It's common for young girls to experience irregular periods during this time. Pregnancy brings about the most dramatic changes in the menstrual cycle. Periods stop completely during pregnancy, as the body focuses on nurturing the developing fetus. After childbirth, it can take some time for periods to return to their regular pattern. Menopause marks the end of a woman's reproductive years. In the years leading up to menopause, known as perimenopause, women often experience irregular periods due to fluctuating hormone levels. These fluctuations can cause a range of symptoms, including hot flashes, night sweats, and mood swings. Your weight can play a significant role in the regularity of your menstrual cycle. Both significant weight loss and weight gain can disrupt the delicate hormonal balance that regulates menstruation. This is because fat cells produce estrogen, a hormone that plays a crucial role in the menstrual cycle. When you lose a substantial amount of weight, your body may produce less estrogen, leading to irregular periods or even the cessation of periods altogether. Conversely, gaining a significant amount of weight can increase estrogen levels, potentially resulting in heavier or more frequent periods. Maintaining a healthy weight through a balanced diet and regular exercise is essential for hormonal balance and menstrual regularity. If you're experiencing irregular periods and suspect your weight may be a factor, it's crucial to consult with your doctor. Section 5. Stress and your cycle, finding balance for hormonal harmony. Stress is an inevitable part of life, but chronic stress can wreak havoc on your hormonal balance, including your menstrual cycle. The pressures of daily life, whether from work, relationships, or personal challenges, can accumulate and lead to a state of constant stress. When you're stressed, your body produces cortisol, the stress hormone. This hormone is essential for your body's fight or flight response, but when it's constantly elevated, it can cause significant issues. Elevated cortisol levels can interfere with the production of estrogen and progesterone, the hormones responsible for regulating your menstrual cycle. This imbalance can lead to a variety of menstrual issues. This hormonal disruption can manifest in several ways, such as missed periods, lighter periods, heavier periods, or more painful periods. Each woman's experience can be different, but the common thread is the impact of stress on menstrual health. Managing stress is crucial for maintaining hormonal balance and menstrual regularity. Incorporating stress management techniques into your daily routine can make a significant difference. Incorporate stress-reducing techniques into your daily routine, such as exercise, yoga, meditation, and mindfulness practices. These activities can help lower cortisol levels and promote a sense of calm and well-being. Spending time in nature can also be incredibly beneficial. The natural environment has a calming effect on the mind and body, helping to reduce stress and improve overall health. If you're struggling to manage stress on your own, don't hesitate to seek professional help. A therapist can provide you with tools and strategies to cope with stress more effectively. A therapist can teach you coping mechanisms and help you develop healthy ways to manage stress, ultimately benefiting your overall well-being, including your menstrual health. Remember, taking care of your mental health is just as important as taking care of your physical health. Section 6. Medical conditions, PCOS, and thyroid disorders. Certain medical conditions can disrupt the delicate hormonal balance that governs your menstrual cycle. These disruptions can lead to a variety of symptoms and complications that affect your overall health and well-being. Polycystic ovary syndrome, or PCOS, is a common hormonal disorder that can cause irregular periods, acne, and excess hair growth. Women with PCOS may also experience weight gain, difficulty losing weight, and even infertility. The condition is often diagnosed through a combination of medical history, physical examination, and specific blood tests. Women with PCOS often have multiple small cysts on their ovaries, which can interfere with ovulation. These cysts are actually immature eggs that have not been released during the ovulation process. This can lead to a range of symptoms and complications, including difficulty conceiving. Thyroid disorders, both hypothyroidism, which is an underactive thyroid, and hypothyroidism, an overactive thyroid, can also wreak havoc on your menstrual cycle. Hypothyroidism can cause symptoms like fatigue, weight gain, and depression, while hyperthyroidism can lead to weight loss, anxiety, and heart palpitations. The thyroid gland produces hormones that regulate metabolism, and imbalances in these hormones can affect the production of estrogen and progesterone, leading to irregular periods. Proper diagnosis and treatment of thyroid disorders are crucial for restoring hormonal balance and regular menstrual cycles. Other medical conditions that can contribute to irregular periods include endometriosis, pelvic inflammatory disease, and uterine fibroids. Endometriosis occurs when tissue similar to the lining of the uterus grows outside the uterus, causing pain and irregular bleeding. Pelvic inflammatory disease is an infection of the reproductive organs, and uterine fibroids are non-cancerous growths in the uterus. If you're experiencing persistent menstrual irregularities, it's essential to consult with your doctor to rule out any underlying medical conditions. Early diagnosis and treatment can help manage symptoms and improve your quality of life. Your healthcare provider can offer personalized advice and treatment options based on your specific condition and needs. Section 7. The pill and beyond. Medications and menstrual changes. Certain medications, including hormonal contraceptives, can influence the regularity of your menstrual cycle. Hormonal contraceptives, such as birth control pills, patches, and vaginal rings, work by preventing ovulation. As a result, they can make your periods lighter, shorter, and more regular. However, some women may experience irregular bleeding or spotting during the first few months of using hormonal contraceptives as their bodies adjust to the hormones. Other medications, such as antidepressants, antipsychotics, and some blood pressure medications, can also affect menstrual regularity. If you're concerned about the impact of your medications on your menstrual cycle, don't hesitate to discuss your concerns with your doctor. They can help you weigh the risks and benefits of different medications and make adjustments to your treatment plan if necessary. Section 8. When to see your doctor: decoding your body's signals. While some variation in menstrual cycles is normal, it's important to pay attention to your body's signals and seek medical advice when necessary. Consult your doctor if you experience any of the following: periods that suddenly become irregular after being regular, cycles that are consistently shorter than 21 days or longer than 35 days, bleeding between periods, unusually heavy bleeding during your period, severe pain during your period, or periods that last longer than 7 days. These symptoms could indicate an underlying medical condition that requires attention. Early diagnosis and treatment are essential for optimal health. Section 9. In conclusion, embracing the ebb and flow. The menstrual cycle is a complex and dynamic process, influenced by a myriad of factors. Understanding the normal variations in menstrual cycles and the factors that can contribute to irregularities empowers women to take control of their reproductive health. By listening to our bodies, tracking our cycles, and seeking medical advice when necessary, we can navigate the ebb and flow of our menstrual journeys with greater confidence and well-being. Remember, you are not alone in this journey, and there is always support available to help you manage your menstrual health effectively.